kai fongo fionga le presidente ia toaolo mana ia froin ia me se foi le fionga le fontalai ia savali talvogale ia malo ka to komiki ngi ka ia lewa mai a koia oli e kulanga le lorong ia ko kasi lava ka kom kanga luenga munmuri lea onga mai alo ka ko ngaluenga ngias ia ole mau kanga singase ia olo ia le kusi le pakeki dale mau kanga singase leo peonga whakaungu mai ko fionga ia lo ia le pakeki dale mau kanga singase ia na bara wa ku ka komun mau ne sungon fatonu male malun kanga luenga ia e sumai ma kar mai au ia ngalo sa umai le subsidy mai malo kele ia pe nga foi ka ko malo ia o pasenge mai le tax le swau se kulo ia la loi folo e foi le famangianga mai le ARPA ia mangai grants nga lo la lo umole ole mkanga luenga ia le mau kanga sengase ole a ku fakasi umale fakasinga ole luas fulu lima o langa pakeki sai ai se lau kolus fulvidionga iwa se lau markas afe fa se lau valu lima afe sfu malua ka fenga luenga ole kalsanga mo luas fulongo ia se lau iwa su kol milionga fa se lau iwa fulu afe se lau valus fulu iwa ia ka fenga luenga ia fa kasinga akonga ia ma fa mangianga lo avakuri malo fa penga foia malo kele ia vakule fakalo fai lau sunga le si o ringe ka au lau sunga Anesi ia mai se foi le mamalu le ka kum kanga luenga mai le mau kanga singas ia ile sumai makar mai au ringe ka ia wa kumuri ka ko fa moi le kum kanga luenga ia ka ko ke fakal ngoinga kulanga ko pakek ia ala ko ko le mongo ia sa nganga lau sunga faton no fa lo
tai lava la fionga tai committee lau a FONO mo ne avanoa vi ia pea le alofa ma le anga le atua wa tato mo ai le nei lau matango fie o mawhai ai on tato wheloa i fie iai le maa pue ma le maua lunga tato whatasinga o te mua ai whatulou ma whaata alofa atu i le pa ia ma le malu e mauta whaitu la FONO Malta maua e fio mai o lo fionga presidente, sui presidente, ai mai se tupu mai e o tato atu nu. Malta sui, fio lo fionga fono fetalai, sui fono fetalai, ma sui fili o i tu malo tai tasi o tato whainga malo. Tai o manuia, tai o toa, tai o fia le alofa ma le anga leo le atua soifua. Le anganga whaftai, mo le nei awa noa tāua, a wāli ilu i longa o tato pātiketi. Awa moa nei awa noa, ma le awa au te fia whai loa tu fo i nisi o lo whaatasi mai nei tae au, whai masui o le matanga duenga. O lo i tū tamatau, o tina lea ia Sabrina Lau Pepe, o ia lo le acting CFO team i nei o tato whai mai. I o lona tamatau, o tinale ia taua mailo o ia ro fai ma controller i whainga teu tupe o tonu o whan mai. Ia lo i tuanga vale o Victor Tuiasopo o ia lo ngafa ma le finance le grants o le mato cost analyst. Ia ma le awa tele whaftai.
Hei, ia whafonga le ia le kako kumiki. Sa wangi fo e sunga whatonu ia mo le ngai kai au. Ia la koko mongoa le malu kumiki. E kako siri ia mo le kako mkanga renga ia fionga whanga ima i fot kako mai na mole
ia e mo dia tu le nganga fa te tele i lua fionga te komiti o le nei fo i avanoa ia ua le fa mo al tato le anga le fa mai Mole lima whaatalofa mwhawhewha ia tu le malor tātou LPJ lau mai lau whionga le o mai tātou CEO sunga Anesi. Ia me soi ma malu le tātou mai umwhai o tātou awai nei tai au. Malo le soi fo maua ma le langi ma. Lau whionga CEO, I just wanted to, before I get into your budget, I wanted to actually, because it reflects on the ASG audit report, that LBJ had a net loss of 34 million in audit report FY 2024. If I'm can you explain exactly? That's quite a substantial loss, net loss or tato for Mike. This is the committee manenta mawumaya tato reportifol audit report. Ya lasa we tonu le loss le tato for Mike. Can you let us know what happened to that 34 million and what happened? This is on your audit report FY 2024.
Yeah, whawtaila wa mula noa mone siri rofianga. Ai se I hatu lo watu, se Itali aku I le ngangana whaperetania. Thank you, Honorable, for the question. That audit report that shows the net loss of $34 million is in the section of the operating cost. LBJ Hospital as a whole has been operating at a loss for years because there are services that are on operations that are for LBJ's expense but are not billable to CMS. And when we get into the budget, some of those line items are in there. What is also stated in that report, Honorable, is below that section, there's a non-operating revenue section, as well as a non-operations there that shows a net position, sir. So the net position that's explained in that second there is what we use to reallocate to account for that loss. Now, in that audit report, it's still at a loss. I believe it's about $2.9 million, a little over $2.9 million that we operated at a loss in 2024, sir. But the operational loss of the hospital that we're operating on is $34 million. Now, how we offset that is we use non-operational revenue such as grants as well as other funding sources to offset the operational costs, sir. And the ASG subsidy is also one of the non-operational subsidies that we use to offset the $34 million. So the key takeaway in that report is the net position. The net position then shows the operational costs versus the revenues that were done during that fiscal year, and the net position is at a negative $2.9 million on that audit report, sir.
What exactly is LPJ doing now to prevent any future loss? The fact of the matter is, if it wasn't for these federal grants and so forth, we wouldn't be able to recover from that. And Ms. Tato projected local revenue moving forward, because what exactly is we're going to try to do is prevent, that's a substantial loss. That is a substantial loss. If we didn't get any federal grant, we would have had a huge problem in LPJ. What exactly is we planning to do to move forward so that we don't have this kind of problem anymore?
Thank you, sir. Thank you for the question. So it's important to note what exactly goes into the operational debt, and I think that's where we need to start. One of the main things that the hospital is doing and taking the loss at is for certain services. The morgue is one of those services. It's not a billable service for Medicaid, but it's a service that the hospital wants to provide to the community, but it's taking it as an operational loss. There's also other ones, such as the addition of our contribution to aid in the EMS vehicles as well as the medical supplies. That's a cost that the hospital is fronting that's not billable to Medicaid. And I know we can discuss more about that later. But there's certain operational costs. Also, in the last year, we have over $3 million in accounts receivable for self-pays of unpaid hospital bills that we're also taking at a loss. And we cannot refuse treatment. And so we can work out payment plans, even if it's something as low as $10 for the person to come in, but we will still deliver the care to that person, even though these bills are accumulating over time. The next is the subsidy, sir. So ASG's subsidy right now in arrears to us is a little over $2.3 million, and that extends to FY 2024. There's still over $300,000 that is owed to the hospital based on this subsidy, as well as that's in fiscal year 2024. In 2025, the $2 million that was allocated from ASG to the hospital has also not been paid. So if we can budget for these receivables and take them as an income as part of our income statement, but if the income doesn't come there, then it's gonna be reported as a loss. And if it was carried forward from previous years, then we're always gonna be operating at a loss, sir. So we're trying to first address the accounts receivables and make sure that those income statements match. And then second is evaluate where the losses are coming from. And so these services that we're evaluating for losses is what we're working on, trying to increase then the revenue to account for these services. The last thing we wanna do is stop services, but we wanna make sure that we're diversifying our revenue source to be able to account for services. And the last thing, sir, is we're looking at going to professional fees, which is one thing that's not reflected right now. How the hospital generates revenue is we get a reimbursement based on the patients that we see. So for example, the clinics, it's about $647 the operating cost of that visit to the patient. Now, what's billable to that to CMS is a little bit less than that. It's about 80% of what we do, but we front load that cost. And then with the audits after the year, we get the reimbursement. But sometimes the cost of that visit is a lot higher than the agreed upon methodology for that. So we're talking about some visits that take 2 minutes and some visits that take 3 hours. We're getting reimbursed the exact same money, but the amount fluctuates between that visit. So the next step that we're doing and we're negotiating with CMS is to now make sure that we can now charge for the professional fees that the providers are giving and not just a reimbursement based on how many visits that happen to the hospital.
All right.
Thank you.
Yeah, let's go to your budget, CEO. Your summary budget from one of your first page. According to your operating revenue in 2024, again, we don't have the 2025 yet, it's 62 million. You're projecting 100 and something, literally 100.1, well, 100 million you're projecting here on revenue. That's quite an increase from what you had from 2024 as the operating, and I'm talking about just local, the ones that you're, your grants, but this is what you're projecting that you're going to collect on the local level, Medicaid, Medicare. Is that a realistic amount that you're looking at 100 mil? Again, going back, 62 million was your operating revenue in 2024.
Yes, thank you, Honorable, for the question. So this estimate, what we've done is first we've looked at the revenue over a 5-year cycle. So this is an analysis of that, but also, as mentioned previously, sir, we're accounting the pro fees. One of the areas that, if you notice over the fluctuation of LBJ's budget, is that we're very heavy on Medicaid, but not on Medicare. And the issue with that is dialysis is one of those services that are then being provided, that the bulk of those clientele would qualify for Medicare, but are not being billed for Medicare. So this projection is we're looking at those that qualify for Medicare and increasing. There's 2 areas of reimbursement that we haven't explored enough in the past. The first one is Medicare, and the next one is CHIP, which is the Children's Insurance Program. So when we talk about Medicare, sir, right now, it's less than 30% of the clientele that qualifies for Medicare is enrolled in Medicare. So the program that we're having now, sir, is the hospital has set aside money to facilitate the enrollment of those that qualify for Medicare, but also pay the premiums for those on a monthly basis. The returns on that is reflected in this budget, as well as the professional fees that mentioned earlier, sir. And this is based on a 5-year projection of encounters at the new rate with the increased Medicare revenue, as well as the new rate for professional fees.
All right, just for your info, CEO, the ASG subsidy is 1.8, not 2 million, so you could make that necessary adjustments. It's 1.8 million is what we allotted for the subsidy from ASG for this fiscal year 2024. Okay, if we move back down a little bit on the ARPA funding, Chairman, can on the latest ARPA spending and all of their ARPA project, and in that ARPA funding, you have 4.9 million allocated for personnel. Is that correct?
Yes, sir.
Okay. Out of that 4.9, 70 of them are on contract and 9 on career service. How are we paying career service personnel with ARPA funding?
Thank you, sir. Thank you also for pointing out the discrepancy within the ASG subsidy. So the personnel was, there's 2 line items that were in the ARPA budget at LBJ that was previous administration, and those 2 line items were the personnel, but it also included the new hospital, sir. And so the new addendum that was worked out with the current ARPA office is because it was a reimbursement system, the hospital never was reimbursed since 2023 for the workforce that was developed. Now, most of that, the bulk of that workforce was done through agencies that we use to bring in our nurses. We also bring in specialists, and all of those were already part of the original line item. The issue with that was that we weren't reimbursed, so we fronted the cost on ARPA, sir. So those were continued there. There was also a line item in the original ARPA account for the administration of the ARPA account. And now these individuals at the time were already part of the grant department and were career service. So they were kept intact. The projects that you see that are on a separate line item, those are the projects that are in addition to that original one that was approved by the ARPA office during the previous administration. Sir.
CEO Famulia, it's actually on page 128. 128, in which it identifies my personnel. And some of these people that are on contract, they're all registered nurses and so forth. They, Alan Abaco City CEO, we all know ARPA is going to be, what, 2026? 2026. So if we're going to continue to keep these personnel, you're going to have to come up with 4.4 million, especially the career service people, because it in you know, I can understand a contract because you can eliminate some of these contracts, or as you mentioned, you source these out. But for the 9 career service people there, and one of them is 107,000, you're going to have to come up with money to 4.4 million or whatever the amount is. So what are the plans? When we're all done by next year?
Thank you, sir. So the plan moving into this year is to establish the professional fees as well as address the accounts receivable. And moving into FY 2027, sir. So these contracts as well as the career service employees will be fully paid up until FY 2027 December, so the first quarter, sir. So the idea is to then find the projection in the first quarter of this year to evaluate how well our professional fees are working as well as our accounts receivable, sir, and then evaluate those for that would then be moved into the different areas in FY 2027.
That's again, that's a substantial amount of money. So, but anyway, I'll leave it to you and the good team that you have there. Bawa si kasangale de report mule. I mean the chairman. We need that report of all the ARPA projects and how much we've already expended on the ARPA for LBJ.
Yes, thank you, sir. To date, we have expended $43 million of the ARPA budget for LBJ. What is reflected in here is that goal of the 75% that will be spent during this fiscal year, sir. But we've already spent $43 million of the allotted money this year.
It's your understanding we're going to complete all these projects by 2026?
Yes, sir.
Yeah, all right. Thank you. Yeah, thank you.
Ya, ilo fiong ale superstain. Fiong mangali.
Yo lava man mlamai. O kupea ale falmai e ko sau ko an falu falma. Afa pe fo e mumu. Ko sang far kupe falmai. It's going to carry over as a negative fund balance. Nga fangadu do falmai e makame ke fa kumul pula. Ima fa ye nga yo falmai. Ele é mas me kasi o channel fund o laku como nga le direct appropriation. Me la le ma ko ele mau. Fa malo lo fa ma yo wa amu mo pula o la ko ele se me ka sanga mai ka ko ele ba ku sku ka ko. Fa ma yo se authority. A umala fa isu ko e mumu. Fa me le ka beginning fund balance is a negative. En voor de kakala ka financial fa mai. E kaulang for fa kumu mod pule. On a dule operation for ma. Me nga ka fu song ye ko ka ku mau ka inga fa mo fier ka ku. Pa wan me le va ko ko le mau ka ku malolo fa malolo la ko. La nga leo la ka umi fu ka ku ka ngo ku pe mo fa mai ko fa mai.
Ya, o ele mau, o ele fa lo inga. Ya, o ese mga ko lau. Ya, fa malolo kun malolo ka ku mau. Ya, le o ele mau. Ya, ai o le ese ka ya o nga ko o mai la le on kanga luenga e ka ko ke fa so a vel le vai fa ia kuma ko mole sunga le tu ka komik ka fo le fionga su president mole ko nga fa kai le sunga fa ton CEO male malo kanga luenga ia mol ka ko lo longa ngai ka ai fa mole ka ko ai ka ko di pokinga saprina fa mole ai o nga mole mai le ofisa o manga ka ia se si la ia kamaya mkinga yo le kungu ai manguia lava le sunga fatonu man malum ka ngalenga ngi yaso fatai
ya mori foi lea ave ia lea lau leo e fatsau fa ai fai masui foi committee fa foi ar fal mai fa pena foi mala fai ngalenga mori lava le anga fatai fautuanga ia malatu foi ai ia lofa mai pea le atua wa ia fofuanga ne aso fatai soifua ia manuia
Hey, on sai mai Anesi. Mangkol ka report. Ya, malo se fo. Nalo tam tu.
Yes.